Good afternoon, everyone. You are very welcome to the launch of Healthy Ireland Progress Report 2015 to 2020. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to Sarah McCormack, Healthy Ireland Lead in the HSE. Thank you.
Good afternoon, and you're all very welcome as we join here this afternoon to the launch of Healthy Ireland in the Health Services Progress Report 2015 to 2020. As you've heard, my name is Sarah McCormack and I'm the National Lead for Healthy Ireland in the Health Service. Maybe I should have started off there by saying hi to you all. I think over the last number of years, you will have become familiar with this very vibrant green colour that you can see behind me, which of course is the branding for Healthy Ireland, and that lovely logo that goes with us that says hi, that call out to everybody across our country. As we're going to go through this afternoon's session, we will be looking at the progress that has been achieved in the implementation of Healthy Ireland, led out there through the Health Service. But that leadership and that work that we are referring to here today could not happen without the great support and collaborative working with many organisations across the country and linking in with many government departments. With over 700 people registered here for this webinar, I know that a number of you are coming from those organisations. So I hope that you will take a great sense of pride and achievement as we talk about the progress being achieved here over the last number of years. Because without that collaboration and without your involvement, we simply couldn't make that progress. Maybe I could say I got on the Healthy Ireland bus in 2014, and that was when we in the Health Service started looking to see how we were going to progress Healthy Ireland. And of course, we were building on the Healthy Ireland framework that was launched by government in 2013. That framework is taking us up to 2025. It's a long journey, and it's a very clear journey and a very clear roadmap for all of us living here in our country. And what was the whole focus and the drive behind that framework? And it simply was to actually halt the ever increasing rates of chronic disease. And those chronic diseases that we're referring to there are the cardiovascular, the respiratory, stroke, cancers, mental health, and diabetes. Of course, chronic disease is a worldwide issue, and we in Ireland are equally impacted by it. So when we actually just think that 49% of our population over the age of 50 have at least one chronic disease. 1 in every 10 over the age of 50 has diabetes. 1 in 4 of us will experience a mental health challenge. And we have 35,000 new cancers every year. We all might say, okay, so what can we do for it? Maybe let's get the Health Service, get a fix for this. But the good news is, and the real news is that chronic disease is largely preventable. And it's preventable because the key known risk factors have been identified through evidence and research. And those key risk factors there, focusing on smoking, the misuse of alcohol, unhealthy eating, inactivity within our lives, and leading to and entwining there with overweight and obesity, and with stress coming into our lives. So the Healthy Ireland framework set out for us in Ireland to address this problem, because those key risk factors are very much led in relation to what we as individuals do, the lifestyle that we actually live, and of course being supported by an environment that can help us to make the healthy choice the easy choice. The Healthy Ireland framework has 4 goals there, and there's 2 that I'm just going to remind us of this afternoon. One being to increase the proportion of people who are healthy at all stages of their life, and the other one to create an environment where every individual and every sector of society can play their part and have the opportunity to achieving a healthy Ireland. So that framework brought about a movement across our country. It called out each one of us as individuals, our families, our communities, our schools and our workplaces to come together and to halt and to push back that ever increasing rate of chronic disease. Chronic disease is putting an unsustainable impact on our health service. It impacts the economy of any country, but most importantly, it really impacts the individual's life, taking away the quality of the life that we have. The framework called out there to the health service and said that we in the health service must take on the role of stewardship and advocacy, that we must support all the other organisations to come on board and help in their health and well-being. So it was on that call out that we in 2015 published the Healthy Ireland Implementation Plan in the health service. And after an amount of consultation there, we concluded that we developed our plan based on 3 key strategic priorities. And those priorities being to build on the structural reform that would take place in the health service, embedding prevention at the heart of everything that we do. To reduce chronic disease being the greatest challenge to our population at large, and to improve the health and well-being of our staff, our greatest asset, and we being the biggest employer in the country. That plan then took those 3 strategic priorities and then broke it down into 126 key large-scale actions. And today, it is the progress on those 126 actions in that progress report that we are launching and that we are covering here today. So in this webinar, you will hear from some of our national directors in the HSE, from our colleagues there in the Department of Health, Healthy Ireland, from our hospital group CEO and community healthcare organisations. And of course then, as you know, we have our guest speaker, Professor Kieran Boyle from the RCSI, Positive Psychology and Health. And to add into that and make it all the more interesting for yourselves, we have entwined in there some videos. So for our programme, I am delighted to invite in now Dr. Stephanie O'Keefe. And Stephanie has been the National Director for Health and Wellbeing since 2013 to 2020. Stephanie is now the National Director in the HSE for Integrated Operations Planning. Stephanie has been at the helm of Healthy Ireland since 2013, and her commitment, her leadership, her knowledge and her vision in this area has led in no small way to contributing to the achievements that we have actually included in this progress report here today. So Stephanie, our pleasure to invite you in, and over to you.
Hi, Sarah. Unfortunately, Stephanie is experiencing a little bit of technical difficulties at the moment. So if we could move along to another section of the event, please.
Okay, well, maybe then while we're actually waiting for Stephanie to come along, and we are having a lot of technical problems in the HSE here today, and look, we all hope that everybody's network will keep up with that. So what we actually will do is I'll give you some entertainment here. And one of the ones we'll actually look at here is a choir. So why are we bringing in here choirs and singing? Is because that over the last number of years, we've actually been learning and finding the research that's there in identifying how good that singing and actually music and singing particularly there is in relation to our health and well-being. So a number of research has been carried out there in this area, and it is actually showing the link between health and well-being and that piece of actually singing. So one piece of that research you can refer to there is in relation to Singing for Your Health, which was done there through the UL University there in Limerick. Another one there, which was launched just there about a week ago or 2 weeks ago, was actually Sing for Ireland there and with the UL University. And what they actually did was they mapped out choirs that are there across the country. So there's choirs there that sing for health and well-being. There's a map online. You can go online and you can find your choir and you can join that choir. This one that I'm showing to you here now is one that actually is coming from a national health and wellbeing concert that we had. And in that concert, we had a number of choirs, because in the HSE we have a number of choirs. And here we had Galway, Tullamore, Ennis and Limerick. So we have been running a national concert for the last number of years. Last year we had to do it online, but now sit back and enjoy the voice of one of our national health and wellbeing concerts at that time. So Helena, let's play the choir.
Well, someone started
wouldn't that lift anybody's heart to hear that wonderful music? And as you saw there, that included 8 workplace choirs as well. They're coming from the HSE. And there's always that great feedback that people feel about being involved in a choir, but also the piece of actually giving out and giving the singing across to them into it. So Helena, I'm just going to check, is Stephanie joined back in with us? Yes, can we go to Stephanie at this point?
Absolutely.
Okay, Stephanie, you are very welcome. So Stephanie, I had introduced you earlier. I don't know whether you were online and you heard that, but let's take Stephanie before there's any other technical problems, and delighted to have you online, Stephanie O'Keefe.
Thanks so much, Sarah, and good afternoon, everybody, speakers, singers, colleagues and attendees. I did actually get most of that, Sarah. It just dropped at the start of the choir, but I'm back on again and hopefully the network kind of survives. But I'll speak quickly and get through the main messages to all of you listening today. It's very much a pleasure for me to be able to mark and report the publication of this Healthy Ireland HSE Progress Report. Population health improvement has been a professional preoccupation for me for the last 10 years. And I would say a passion very much. 10 years ago, I moved to work in the Department of Health to lead the drafting and publication of a population health framework, which became known as the Healthy Ireland Framework, published by government in March 2012. And then I went to head up a HSE Health and Wellbeing division responsible for the implementation of that plan across the HSE. And what we have here today is a report that gives a really good snapshot of what's been delivered from the period 2015 to 2020. The finalisation of this report, it began before the pandemic hit, and the finalisation has been delayed by the pandemic. And it's fair to say that there have been a lot of learnings for all of us in working through the challenges posed by COVID over the last 20 months. And to my mind, one of them is the extraordinary capacity, commitment, dedication and resourcefulness of our staff and our partners that we work with, and the importance really of stepping back and recognising that. I think so often, and particularly working in the public service, I've noticed this, that we work with an incredible pace from kind of objective to programme to deliverable back into another objective on the basis of what's been achieved. And whilst we do mark things with regard to evaluation reports and so on and so forth, we don't really take a breath and look at the incredible work that has been done and the challenges that have been met and the difficult times that we've had in getting there. And for me, in reading this progress report, it is a testament to the extraordinary efforts made by many people, groups and services within and outside the HSE. And I think it's just really important to recognise that. And this is really the essential ingredient needed to deliver on what is a significant programme of transformation. And there's no alternative ingredient. I was thinking recently about how we Google, what's an alternative to baking soda when you don't have it in a recipe. I mean, ultimately, there are lots of different enablers to doing this work, but you can't replace this one. The expertise, the commitment and the resilience and the hard work put in by so many people has meant that this progress report has been possible, and all of the incredible work within it has actually been delivered through the HSE and through our partner organisations. And it's fair to say that the Healthy Ireland framework itself, that policy, did set the bar very high. It delivered in policy terms across government dependency on achieving better health with nobody left behind. It was and still is very ambitious, and it is ambitious in the context of a still existing international drive to address the wider determinants of health, the fundamental unsustainability of healthcare systems as they're currently delivered, and widening health inequalities across many jurisdictions. And a new implementation plan has been published this year by the Department of Health that very much keeps that bar high and resets priorities and actions informed by learnings to date. And within that plan, and indeed within similar plans internationally, they all recognise the important advocacy and delivery role of the health service in implementing and supporting the continued implementation of a cross-government whole of society framework. And our ambition within the HSE in terms of trying to bring it to life really was to create and sustain a movement. And we acknowledged the pre-existing work that had been there in the very good practice, and we focused on putting in place structures to lead and to deliver and to create a sustainable delivery system in the HSE for the prevention agenda. And the work is supported by a very strong approach to programme management at every level of the organisation. Our national implementation plan in 2015 set out 126 actions across 3 high-level priorities: health service reform, reducing the burden of chronic disease, and looking at staff health and wellbeing and improving staff health and wellbeing as a priority also. And they were all to be supported by enabling functions and supports, including strengthening our partnerships and collaborative working. And it is quite a testament to that resilience and to that drive and that hard work that 90% of those actions have been delivered, and the remaining 10% are in progress, or we're redefining them on the basis of learnings around how better to undertake or to do the work. And the progress report sets out deliverables across those 3 areas, one of which, as I said, is health sector reform and enablement. And since 2015, we've seen some very significant deliverables and developments in that period, one of which, of course, is Sláinte Care, where prevention, early intervention and population health improvement is identified as an underpinning requirement for future health and social care. And this was really a very important development, informed, of course, by the evidence base and all the work that was happening on Healthy Ireland at that time. The other very significant development, of course, is since 2015, a whole array of subsidiary strategies have been produced by the Department of Health and by other government departments, whether it's in relation to active living, healthy eating, sexual health, tobacco, healthy childhood, positive ageing, housing, social inclusion strategies. And all of this policy development, actively supported and enabled by HSE expert input, strengthens the mandate, and it strengthens the momentum for implementation and aligns implementation networks, offering much greater scaling and much better pace in terms of implementation too. It wouldn't be, we've done incredible work, and local authorities have done incredible work. They really have provided amazing leadership over the last number of years, where actions on wider determinants of health, of course, are key, from the environment to employment to housing to social integration. And over this period, we've seen huge leadership, as I say, from local authorities, planning and publishing for the first time healthy county plans informed by national policy. Local authorities leading in the area of community engagement and positive ageing has been a massive development as well. And they've actually put Ireland on the stage leading with regard to the healthy ageing framework and programme now implemented in every county of the country, supported by older people leading alliances at a local level of delivery, like really fantastic work. And the HSE has made real strides over the last number of years, developing these mutually beneficial relationships, influencing and advocating for health and wellbeing, and seeking prioritisation in local strategic plans and investments. And the Healthy Ireland Fund, created by the Department of Health, has been a valuable enabler for local engagement and ownership in that regard. We established within the HSE policy priority programs supported by enhanced clinical leadership, mirroring these national strategies in the area of tobacco, alcohol, sexual health, healthy childhood. And these small but very strong, robust policy priority teams monitor the evidence, they track progress, they develop business plans, they set more detailed targets and actions aligned to strategic objectives, and they've been a driving force behind the progress that has been made over the last number of years, detailed in the progress report. Our CHOs, our community healthcare organisations, and our hospital groups. We've made progress on creating and strengthening governance and management structures in CHOs and hospital groups to reflect the huge role that services have in leading and contributing to the achievement of the Healthy Ireland framework goals. And a key action in 2015 was the development of Healthy Ireland implementation plans at community healthcare organisation and hospital group level. And all of the CHOs now have a plan, and 5 of the hospital groups have a plan representing tremendous efforts being made by staff to deliver on key actions. And it's wonderful that we've got 2 prominent leaders here today to talk about their work and their perspective on this agenda. It's really important too that all HSE reforms are reinforced by HSE board priorities, and the first corporate plan from our new board has underpinned Healthy Ireland objectives, and that's really important. Again, it creates a very strong mandate across the organisation when we're dealing with very significant service pressures, working with a whole range of service providers, that we don't drop a ball in relation to the prevention agenda, which often can be, as it can be a very big challenge to prioritise in the context of that type of delivery environment. And the progress for me really comes to light when you look at the actions in the progress report around what has been done to prevent and support better management of chronic disease. There have been a number of seminal frameworks published over the last number of years, detailed in the reports. So our self-care, self-management framework for chronic disease, our Making Every Contact Count framework, and the work of our clinical leads in this space, working with policy priority programs, our health promotion and improvement staff up and down the country, is really exemplary. These frameworks have been key critical success factors in recent investments in community care services to better support those living with a chronic disease and enhance secondary prevention, investments in health and wellbeing service expansion in areas of deprivation, including the implementation of some services to support the implementation of our obesity model of care and alcohol support services. And really where it comes to life, what I've found over the last number of years is when we're engaging with our staff within hospitals and community services and with broader providers like our GPs that we work with, is when you hear and listen to a patient advocate talking about how an intervention made by a doctor, a nurse, a physiotherapist, and the advice given to them and the specific support or service given to them, how it has changed and transformed their lives. And for me, that's really where this framework comes to life from a health service perspective. So at the outset of all of this work, we wanted to create a movement, and working with so many partners leading in many different ways, there really is now what I would call a strong gusty movement for Healthy Ireland. I was lucky over the midterm break. I got to spend a little bit of time in Kerry where the winds were really, really high and the trees were losing their leaves, and there was this kind of magic sound of kind of crazy wind. And when I was thinking about and reflecting on the progress report again after reading it in preparation for today's session, I really did, that memory is what came to mind, is we have created a really strong gusty movement, working with a whole range of partners, and it's fabulous to be part of all of that. I would really like to acknowledge all of the people who've contributed to this, particularly the Department of Health and the Sláinte Care implementation team, and our colleagues on the policy side within the Department of Health, and the leadership up and down the breadth of the country within the HSE and outside of the HSE, our national leads for Healthy Ireland, Sarah, in terms of being the national overall Healthy Ireland lead, our health promotion improvement staff, our heads of service, our hospital group CHO staff, and all of the myriad of partners that we work with. I'm delighted to be able to now work with Philip Crowley. I have moved last June to a new role, heading up a planning function for all health service kind of operations. And I will be working with Dr. Philip Crowley, who's now been handed the bright shining health and wellbeing torch, with him to enhance our planning and delivery of Healthy Ireland actions over the next phase, which is now well informed by a Healthy Ireland implementation plan now published by the Department of Health, and broader, I suppose, opportunities in the context of healthcare reforms into the future. Just to acknowledge the organisers today, thank you so much for pulling all this together, and thank you to everybody for listening and for attending.
Thank you very much, Stephanie, and delighted that the network's held up, because as you can actually see, Stephanie's contribution being so valuable to us here today, and you can hear the passion, the knowledge, and the breadth of her interest across in this area. And Stephanie has clearly shown to us here there how wide this agenda is, and indeed how challenging it is. You heard me say there that the Healthy Ireland implementation plan had 126 key actions there for us to deliver on. While 60 of those actions needed a great strong input and drive through our hospital groups and to our community healthcare organisations. And our next speaker, which I'm delighted to invite here today, Colette Cowan. Colette Cowan, as soon as Colette saw the Healthy Ireland framework, Colette took this with grit between her teeth. Colette is the Chief Executive Officer for the University Limerick Hospital Group. And right from the very beginning, Colette, even when she was there previously in the Sailshire Group, Colette, following the launch of the framework, really got behind this and then moved on to Limerick and then started the development of the Healthy Ireland implementation plan. Colette, I'm delighted to have you here representing all our hospital groups, all our Healthy Ireland executive leads and programme managers here today. Over to you, Colette.
Thank you, Sarah, and thank you, Stephanie. We're all incredibly proud to see the work of our staff featured in the various frontline choirs, and I'm not a bit surprised by their talent at all. It is a pleasure to join you today to provide some perspective from the hospital groups as we reflect on the progress made to date and chart the way forward for Healthy Ireland. To date, 5 of the hospital groups have published Healthy Ireland implementation plans, and I have had the good fortune to be involved in 2 of them. Firstly, as Sarah said, as Chief Nurse with the Salehi University Healthcare Group, and latterly with UL Hospitals Group following my appointment as CEO in 2014. The publication of the Healthy Ireland framework the year before had identified a key role for acute hospitals in delivering these goals, and that systematic shift in emphasis from illness to health promotion, of course, presented enormous opportunities for us. A happier, healthier population and workforce will continue to be vital as we look to improve patient experience and outcomes and keep our staff well and control the costs of healthcare. With this in mind, I had identified our Healthy Ireland implementation plan as a priority for the group, and we were excited to publish it in June of 2016. It was developed in line with the national guidance, of course, and was evidence-based in its approach, allowing us to identify key actions which we were confident would resonate with staff following a wide-ranging communication process in advance of its publication. We continue to progress the approximately 60 priority actions that were identified in that plan. And of course, we are already working on the successor document, which will align with the national plans you will have read about in the progress report. To maintain our focus on Healthy Ireland, we have put in place a governance structure and made key appointments to ensure delivery, accountability, and oversight. I wish to thank in particular our executive lead, Suzanne Dunn, our project manager, Emer Laffin, preceded in that role by Laura Tobin, our project manager, Emer Laffin, and Ashley O'Carroll, our health promotion and improvement officer. Healthy Ireland site leads are in place or have been identified for all 6 of our hospitals, all of whom attend quarterly meetings of our Healthy Ireland steering group here locally. So why have we put those structures in place, and why is it important for hospital groups that Healthy Ireland is a success? It is sobering to read in the progress report that 40% of admissions, 75% of bed days, and 55% of expenditure are accounted for by chronic disease. This is an enormous cost on a human level and for the system itself. We continue to deliver on the actions in our plan around self-management of chronic conditions and admission avoidance pathways in partnership with our community colleagues and with families and carers. In implementing our plan, we recognise that as an institution, we're in a singular position of influence to help patients make more informed choices about their health. Our plan committed staff who have millions of contacts with patients every year to make every contact count in line with the national framework. Staff have completed the Making Every Contact Count training to embed and practice as part of a pilot in areas across multiple sites in the group. We are holding regular smoking cessation sessions in our Health and Wellbeing Centre at UHL for our staff and on the wards for our patients. The number of smokers currently accessing the Stop Smoking service is at a rate of about 15 per month. Working with catering departments across our sites, we have provided healthier meal options for our patients and in our canteens for staff and visitors, including calorie counting, and we continue to participate in the Happy Heart Healthy Eating programme. Delivery of some elements of the plan has, of course, been interrupted by the public health emergency. We had run a series of public lectures led by our clinicians and specialist nursing and allied health professional staff around prevention and awareness of diabetes, heart disease, perinatal mental health, breast cancer, and others. The guidelines meant such events and similar community outreach in venues as varied as the local shopping centre to the National Ploughing Championships could no longer be held in person. What COVID-19 has done is to bring sharply into relief many of the challenges Healthy Ireland has been designed to help overcome. While the literature on COVID-19 has a long way to run, evidence is mounting that obesity, smoking, and other factors can increase your risk or indeed worsen your outcome. Social determinants of ill health also come into play, including housing, income level, the type of work you do, all of which influence your risk. With so much scheduled care having been curtailed, questions around equality of access to non-COVID care has also come into focus for providers. It has been a time of immense dislocation and of high general anxiety in our community. The restrictions have been tough on the mental health of our patients and their loved ones. And of course, there has been enormous strain on our healthcare workers. While we have been able to put in place supports for them, the unprecedented scale of what they've been through, the level of illness they have been exposed to at close quarters has been very traumatic for our staff. In society more broadly, we saw alcohol sales in the off-trade increase during lockdown. And the closure of gyms and organised sports saw a few too many of us putting on the COVID kilos. I was more encouraged to read about the post-lockdown increase in sales of sporting goods globally, and I was certainly delighted to get back on the tennis court myself after the lockdown. It would be nice to think that as part of a COVID dividend, a healthier lifestyle kinder to ourselves and to the environment might emerge, one that would allow us to build on the progress of Healthy Ireland to date. To this end, we were delighted to welcome Sarah and others to the recent opening of our Staff Health and Wellbeing Centre at UHL. This recognises that the health and wellbeing of our staff and of our patients are interwoven. If we can recognise the pressures that our staff are under and do practical things to improve health and wellbeing, this can only be good for patient experience. The Health and Wellbeing Centre has locker rooms and shower facilities for staff, for example, who cycle long distances to work or who like to exercise during their lunch breaks. Tables and benches have been set up outside the centre for staff to enjoy a break together. And of course, the centre itself allows us to provide a weekly schedule of exercise and wellness programmes that currently include Pilates, high-intensity interval training, self-defence, flash fitness and smoking cessation. Emer and Aisling are currently planning to set up spinning bikes and yoga as we expand the range of activity in the centre. I am delighted to be able to present a video on UL Hospital Staff Health and Wellbeing Centre after my address. Of interest is that the centre is a carbon neutral building, and that of course accords with the responsibilities on public bodies under the National Climate Action Plan and with the direction of travel of Healthy Ireland. We are all looking forward to seeing where our Healthy Ireland journey will take us next. We're excited about what we can do to eliminate food waste, and in the week that is in it, how can we meet the enormous challenges of climate change? Any initiative around smarter travel will build on the work we've done to date in providing bike infrastructure on our sites, designated parking for carpooling, and a park and ride scheme for staff. We also look forward to an increased emphasis on the arts. We have a well-established arts committee that hosts exhibitions and facilitates musical performances where appropriate in clinical spaces and particularly with children. As you will see from the frontline choirs, we love a song in UL Hospitals group. And what a metaphor for healthcare workers a choir is. People of enormous talent and skill working in concert, but creating something beautiful, each with a role of their own, complementing one another. I can assure you they are all equally harmonious at work. Our consultant microbiologist, Dr. Nuala O'Connell, who was part of the choir, quoted Ella Fitzgerald on Twitter last week, saying, "The only thing better than singing is more singing." I could not agree more. We will always sing the praises of our hospital staff, and we will also sing the praises of Healthy Ireland as we look forward to further collaboration in advancing this truly transformative work. As promised, I would like to present to you a video on UL Hospital Staff Health and Wellbeing, and thank you for your attention. I'm delighted to be here at the opening of the Staff Health and Wellbeing Centre. Staff can use the facilities for fitness classes as a showering facility or indeed a quiet space. I would encourage and welcome our staff to use the centre.
The Healthy Workplace initiative has a very important role to play in driving out the Healthy Ireland agenda, and here today in Limerick this is a testament to making that happen. This is turning the vision into reality with this wonderful centre.
This is a great facility to relax, recharge and get some exercise. There's been a lot of interest in our classes so far. Staff on all sites can avail of online classes very soon, and we're looking forward to seeing everybody.
Wow, and how uplifting is all of that? And Colette, you actually gave a wonderful summary and overall view there in relation to the broadness of Healthy Ireland across the hospital groups. And I want to particularly recognise the great work of the Healthy Ireland executive leads in all of the hospital groups and the Healthy Ireland programme managers. Because in actual fact, when we started working on Healthy Ireland, it was with the hospital groups. We started off there with SailChef and the UL and moving on then to the RSI. And then later on, then we come to our community healthcare organisations who were just coming into structure at that time. So that gives a good flavour of that great work across our acute hospitals there into it, because sometimes it is just so challenging to actually have Healthy Ireland on the agenda in an acute hospital setting, because the focus is on the treatment and care, and putting the prevention agenda is always a tough one. So thank you to each and every one of you for making the delivery of those actions possible. And with that, I am now delighted to welcome in Martina Quealy. Martina, our community healthcare organisation there, and our chief officer with Dublin South East and Wicklow and Dunleary. And I'm going to tell you that Martina is another person that has been with us on this journey, because as I said, when we were developing our Healthy Ireland implementation plan, set up a cross-divisional steering group in 2015, Martina was one of our members of that group. So Martina, I'm sure you must smile and see the actions that we put into that plan. Here we are today looking at them and the progress that's into it. So Martina, looking forward to hearing from a community healthcare organisation perspective. To you, Martina. Martina, just your microphone is just to make sure your microphone is on, Martina.
Okay,
Yes,
sorry,
Martina.
is that all right? Is that better? Sorry,
Great,
thanks.
Martina.
Thank you very much, Sarah, and thanks to everybody. Good afternoon, and thank you for inviting me to address the webinar today on behalf of my Chief Officer colleagues and their teams across the 9 CHOs, which cover the entire country. So it's a really wonderful opportunity. And just to echo, I suppose, what Stephanie said at the outset, sometimes working in the HSE and particularly with the pace and the constant changing demands, it's useful sometimes to take a few moments to reflect on the journey and the path that we've taken. And preparing for today's presentation has given me personally one such opportunity. So that has been really interesting. And I guess to just take from Sarah's point there, from a public policy perspective in 2013, the Healthy Ireland framework clearly set out the cross-government dependency required to achieve the improved health outcomes, where no one was left behind, as Stephanie said. And in 2014, working with Stephanie and her team nationally to develop the Healthy Ireland in the Health Services Implementation Plan, which was launched in 2015, was our step-off point in terms of trying to address what was a significant challenge in the national plan. And since that time, I have to say we have appreciated the national leadership by Stephanie and her team, which has continued with the establishment of the CHOs in 2015 and the appointment of heads of service to a health and wellbeing function at senior management team in the CHO. And that has been extremely important, I believe, from a leadership perspective. And from the point of view of giving the health agenda the importance that it deserves and the status it deserves in pursuing the Healthy Ireland plan. Gradually over that period since 2015, we have allocated staff and important improvement resources to the health and wellbeing head of service and to their teams locally in each CHO. And each CHO, as Stephanie said, has developed a Healthy Ireland implementation plan, which gives a local direction and builds that local capacity and capability to ensure that the shared Healthy Ireland commitment is embedded right across our services at community level, and that we're working to that common agenda and maximising opportunities for health. The approach taken has also facilitated an integration and emphasis within the health services that allowed a course to be set to support the promotion of health and well-being right across each and every section of our service. So whether it's mental health, disability, or older persons, we have a very clear direction of travel. And there's a significant range of topics within those services articulated in the progress report. And the range and flavour is very impressive. And I have to say, probably what has worked from my perspective as a chief officer, and I think many of my colleagues would agree, is that very strong partnership between local and national, where we can leverage off expertise within division without replicating, and certainly accelerate implementation by working in that way. Colette mentioned, as did Stephanie, the importance of working with our staff and making a hero of our size. 120,000 staff employed represent a very significant resource, both at individual level, in interactions with service users, in their communities where people work and live, and indeed with their families. So from a public policy perspective, emphasising the health and well-being of staff and maximising that resource is critically important. I guess from a public policy perspective, the direction of travel in our work certainly found a mirror image in the Sláinte Care report when it was published, which articulated and re-emphasised that prevention, early intervention and reorientation of our services towards a population health approach to address some of those very stark statistics that Sarah gave at the outset of our presentation today. And that policy has subsequently been backed by significant ECC investment. And I think that has been critically important in terms of emphasising the serious intent behind the public policy. So when we look at where we are now, in that really what is about a 6-year period, we have teams that are well mobilised. We have programmes that are effectively working in every single service across the CHOs nationally. We have the Healthy Communities programme and programmes that address specifics, whether it's healthy ageing, chronic disease management across the major topics, and indeed addressing those broader determinants of health through work with local LCDCs, with our local authority colleagues, or our children and young person services committees. And we have fine examples of age-friendly alliances, delivering very significant programmes of work right across the country. And equally, although we didn't need COVID, COVID brought into sharp focus the very strong partnerships that exist between our local authority colleagues and ourselves in terms of addressing the needs of particularly marginalised and vulnerable groups in our community. So we have seen healthy city and county development plans right across the country, and indeed that work continues apace. In terms of the ECC, we now have gone from 9 learning sites in community health networks to 96 being mobilised through ECC investment. So this is a very significant investment and vote of confidence in the programme of work that everybody at this conference today has signed up and pursued relentlessly over the last number of years. And that programme of work also sees the delivery of integrated care programmes for older persons and chronic disease. And indeed, programmes of work around Connecting for Life and mental health have been in existence in each of the 9 CHOs over the last period of time. And those Connecting for Life and mental health programmes have seen a very significant emphasis on prevention and promotion and recovery, which I think is extremely welcome. I would like to, before I finish, to acknowledge the work of Stephanie and her team. I'd like to acknowledge the work of my 9 colleagues and their teams locally, and indeed our external partners across all of our voluntary and other statutory services. And that partnership is what really makes us stronger. The collection is much greater than the individual components and the combined resource. So I'm going to leave it at that. I would urge people to have a look at the progress report because there are very fine examples both in the report and indeed online on very good resources that have been enabled locally to support the health and wellbeing agenda. Recently at our Excellence Awards, we looked at one of the Sláinte Care programs that had utilised our health and wellbeing resources in terms of support for diabetes and looked at outreach models in line with the ECC programme of work. And just as a point of reference, in a very disadvantaged community, we saw attendance rise to 100% from a group of individuals who were considered by the consultant and the team in the hospital to be very high risk, and where the DNA was so high that they were concerned that during COVID of a significant deterioration in people's condition. And it brought about an accelerated approach to the decentralisation of that outreach programme, and the results were quite significant. And I think it's really helpful when we're working together across community and hospital, and indeed national and local, that we begin to bring together that data to show us where our resources are most effectively deployed. So I think my time is up. I'll certainly leave it at that for today, but thank you for listening, and it's been really interesting to hear Colette and Stephanie and Sarah, and I'm looking forward to the rest of the presentations. But I think I'm now passing over to an example of one of those national resources, which is the Living Well video, which I think hope people will find really interesting. So thank you very much, Sarah and colleagues.
Hello, my name is Stephanie O'Keefe, and did you know that 1 in every 4 adults living in Ireland are living with a long-term health condition, whether this is asthma, COPD, diabetes, heart failure or stroke? And one of the key objectives of Healthy Ireland and our community healthcare organisations is to support these people to live independently and well. And that's why I'm really pleased to introduce Living Well, a programme for adults living in Ireland with long-term health conditions.
Living Well is a free group self-management programme. It supports people to develop the skills to live well with a long-term health condition. It is proven to be effective in helping people manage their health better.
I am currently living with heart failure and cancer recovery. I was delighted when I found out that I could access the online Living Well programme for a 6-week course, and that gave me the confidence to be able to deal with my issues in a safe way.
I have type 2 diabetes and arthritis, so I understand the challenges involved in living with a long-term health condition. As a facilitator on the Living Well programme, I find it very rewarding to see participants grow in confidence as they develop a sense of control over their health condition and their lives.
Supporting people to self-manage their own health conditions improves their health and quality of life. The Living Well programme is part of HSE's patient-centred care and supports patients to self-manage and become active partners in their own healthcare.
Thank you very much, Martina, and what a vast amount of information there included in those few minutes, just looking across and reflecting in the work that's been done in the CHOs. And indeed, Martina, I too join with you, and particularly with the heads of service for health and wellbeing out there in the CHOs. We know when we started that journey back in 2017, and the wonderful Healthy Ireland plans developed in all your CHOs, And those plans played such a pivotal role in guiding our development of healthy city and county plans, bringing all of it together in that great united way. So now we have been looking, I suppose, primarily talking about the progress achieved. And as we now move on, I'm delighted to welcome Tom James, Principal Officer with Healthy Ireland in the Department of Health. And really, as we come here into Tom James, and Tom, you're very welcome because you are very new into the Department of Health and Healthy Ireland, replacing our great friend and colleague who we worked with so closely, Katie O'Flaherty. And Katie, I give you that big call out today and thank you for the great work that you've done with us over the years. And we are welcome to have Tom James here with us. And you have heard earlier on there, Stephanie referred to it and Martina referred to the strategic action plan there developed by the Department of Health looking at the next few years. So it's good now that we actually start looking to see how do we build on the information that we have, the progress made, and look to the future and the challenge of the future. So Tom, you're very welcome.
Thank you, Sarah, and good afternoon, everybody. I'm delighted to be here today. As Sarah said, my name is Tom James. I'm the head of the Health and Wellbeing Programme in Healthy Ireland in the Department of Health. So I want to firstly congratulate the HSE on the milestone of launching your progress report, and in particular on behalf of the Department of Health to thank everyone in the HSE who's been involved in making Healthy Ireland such a success across the HSE and in what Stephanie has rightly called the movement, which was a nice way of describing it. So before I dive into the topic of the day, I wanted to just remind us all of the context. Now, I know Sarah referenced this in the introduction and Colette indeed made reference to it in relation to hospital admissions, but you might indulge me for a moment. So the WHO have recorded that 71% of worldwide deaths are down to non-communicable diseases. There's a higher prevalence in lower socioeconomic classes. And the most striking fact, of course, is that a lot of these non-communicable diseases can be prevented through changes in lifestyle behavior. So for anyone who's dipping their toe into this area for the first time, I'd recommend an excellent TED talk from an Irish GP, Dr. Mark Rowe. And what he is pushing is what he's calling a prescription of lifestyle as medicine for the prevention and reversal of disease, which is really what we're all about in Healthy Ireland. So I'd like us all just to reflect on today that what we do in the Department of Health on the health and wellbeing side and what you do in the HSE in Healthy Ireland across the health and wellbeing offerings, it really matters. And it has the capacity to change the trajectory of all those rather damning statistics that we spoke about. So myself and the Healthy Ireland team work very closely with our colleagues in the HSE. And when you look at the excellent progress report that's been launched today, I think it gives you a real sense of how embedded health and wellbeing is across the HSE. There's full buy-in at senior level, and indeed, Stephanie was a real champion of this for many years, and this continues with Dr. Philip Crowley now. There's initiatives and programs right across the HSE, and I'm particularly passionate about workplace wellbeing, and I would like to congratulate Sarah and the team for their excellent work in this area in supporting the HSE staff. And an excellent example that we heard about in terms of the Health and Wellbeing Centre in UL Hospital that Colette mentioned. So as some of you know, the department, we launched our Healthy Ireland Strategic Action Plan in May of this year. So Healthy Ireland is a Government of Ireland initiative, and you can see the support for the programme in the forward of the plan by the Taoiseach, who concludes by saying, Healthy Ireland provides the foundation on which to build a better society and a brighter future. In developing the strategic action plan, we of course consulted widely with stakeholders, and I would like to acknowledge the significant input of the HSE staff in the development of the plan. I think our vision is worth calling out. So it's a healthy Ireland where everyone can enjoy physical and mental health and well-being to their full potential, where well-being is valued and supported at every level of society and is everyone's responsibility. So all the deliverables that we have link back to this vision. So the plan also revised the Healthy Ireland's outcome framework, which you've heard referenced a number of times. And as we all know, a person's health and well-being is a function of a lot more than just the health issues themselves and are determined by much broader factors. The Healthy Ireland framework has 14 additional indicators now, including the leading causes of premature mortality, which, as we know, are non-communicable diseases. So we have 6 priority areas: keeping active, staying connected, switching off, being creative, eating well, minding your mood, and minding your body. And from some of the things you've heard referenced from my HSE colleagues, you know that the HSE are very active across all of these areas. So in our plan, you'll see that we're taking a place-based approach to implementation. So we have some great initiatives, which many of you will be familiar with. One of them I just thought I'd briefly mention is the Healthy Clubs programme. And this project empowers clubs to deliver health and well-being, sports clubs, to deliver health and well-being information and programmes directly to their members, but more importantly to the wider communities in which they sit. So the clubs open up their facilities to non-members and have developed walking tracks to support the uptake of physical activity in their community. So it's bringing the whole community together, and you'll see that as a recurring theme. I wanted to briefly mention 2 initiatives that have launched very recently under the plan, and the first one is the Healthy Campus Initiative. So this is a joint initiative with the Department of Higher Education, Higher and Further Education. Minister Donnelly and Minister Harris launched it earlier this year. And funding has been provided to higher education institutions to implement a Healthy Campus Charter, with funding also for a national coordinator who's going to work in the Higher Education Authority. And again, I'd like to acknowledge the significant input of the HSE in the development of the framework itself. So you've heard a couple of people mention the Healthy Communities Programme. So many of you will recognise Melanie McClune there, who's the Chief Officer in the CHO Dublin North City and County. So Melanie was speaking at the launch of our Healthy Communities Programme a couple of weeks ago. So there are 19 communities that we are investing 13 million in 2022 to try and address some of the health inequalities through the lens of the wider determinants of health and using a whole of government approach. So 10 million of this funding has been provided to the HSE for the rollout of health initiatives. And we've worked with the HSE to identify programs that we know already work and make a real difference in the communities, such as the social prescribing program. And what is key here is the HSE had links in the community partners to allow us to roll out these initiatives, and we were building on success that was already there. We in the department have also continued our partnership with the local authorities, and we're funding local development officers in each of the 19 areas. We're also putting in a national coordinator to oversee the project. And I think crucially, and what we're trying to do is we have buy-in from all government departments who are sitting on a senior officials group to bring that whole of government approach to addressing the wider determinants of health. We're also providing once-off funding of just under 5 million in the form of what we call an enhancement fund. So you see a couple of examples of some of the projects that have been applied for there. We've seen some excellent applications, including health activity hubs, community kitchens, social spaces, and outdoor exercise facilities. And the key behind this project was we wanted to improve access to amenities in the areas and to invoke an improved sense of community. So we've significant work ahead to deliver on our strategic action plan, which runs out to 2025. And I know the HSE will continue to be a key partner in delivering upon these actions. And I look forward to continuing to work with the team over the coming years. So I'm just going to finish with this, and this is hot off the press and somewhat of a shameless plug. So in Healthy Ireland today, we're launching a new citizen engagement campaign. We know from our Healthy Ireland surveys that 92% of people want to try and make changes to improve their health and well-being. So this campaign, which will run across national TV and radio stations and social media, is going to point people to our Healthy Ireland trusted information about how to go about making improvements, and also to give people advice on how to start and stick with a healthy habit. So I would encourage you all to keep an eye out for the campaign and to get behind it. So thank you to you all for your attention. If you do want to get in touch with us in the department in Healthy Ireland, the contact details are there, and a copy of the slide deck will go out after the event to all participants. So thanks very much.
Thank you very much, Tom. And indeed, I look forward to working with you over the coming years and wish you the very best of good luck in that new job and that very challenging job that you have, which you can hear the enthusiasm and the energy that you're actually bringing to that. As I said, I want to pay tribute there to Kate O'Flaherty and indeed to all of the colleagues there in the Department of Health, because there's one thing I will say, and I think is really an example here of that. I do believe that the HSE, Healthy Ireland, the HSE Health and Wellbeing and the Department of Health are working hand in hand and really well and collaboratively on this agenda. So a big thank you out to all of the colleagues there, Greg Stratton, Sheila Caulfield and Fiona Gilligan and Mary Ryan, all of you. It's great to be able to say we're all on that first name terms and working together with that. So now Tom has set out the strategic action plan going into the future. And I'm now delighted to welcome Dr. Philip Crowley. And Philip, you've heard your name mentioned here, and I don't know whether you're feeling the heat on your back at this stage or not, but Philip is now the National Director for Strategy and Research, and with that, he has Health and Wellbeing, and in that mix is, of course, Healthy Ireland. And Philip, before that, was in relation to quality and improvement. Philip, you heard Stephanie say about that you're now getting that bright shining torch of Healthy Ireland, and I know that that's the way you feel about it, because you are very, very committed to health and wellbeing and very committed in relation to many areas in this field. So I will hand over to you, Philip.
Thank you very much, Sarah, and thank you to all the speakers. Yes, indeed, it's quite a torch to take over. Stephanie's done extraordinary work in this area with obviously with yourself and Helen Deely and all the colleagues who work in this, such a talented group of people. I think it's a tough act to follow, and I'll be working closely with Stephanie anyway throughout the next number of years to support this really critical work. It's great to see, isn't it, the Department of Health, the leadership in the HSE, and our own talented staff kind of working together in this way, because things don't always work that way. And thinking back over the presentation so far, Stephanie gave a really strong and clear picture of where we've come from, and it's a long journey, and we haven't arrived at the destination by any stretch. I thought the song that the choir was singing, "You're the Voice" by John Farnham, that's a very uplifting song, and it gives you the feel for how that kind of activity can create well-being, and there's a lot of evidence to show that this isn't just having a nice time. There's evidence behind all of these activities. And then to hear Colette's kind of depth of commitment and duration of commitment. The fact that I'd love to see that staff wellbeing centre. It sounds fantastic, and I must say I'd like to take Colette on in a tennis match at some stage as well, because I'm also play tennis. I don't know how well I do, but I give it a shot. Then moving on to Martina and the kind of commitment that she shows, and it's palpable and audible when she presents. We're in very good hands with leaders of this nature throughout our health system, because certainly this is not something you sort out in a department or in Dr. Stephen's hospital. This is something that happens in communities, in workplaces. It happens where patients meet our staff, and Martina referred to that kind of local national link, which I think again isn't something you can take for granted. Sometimes national interests and local interests don't always coincide, and there can be tensions that are healthy. But I think in this space, I think what's very clear is that we're working very much off the same page and working very strongly in partnership with each other. And that's the only way we're going to have an impact. And to have this strong policy framework that Tom has laid out, particularly with Sláinte Care coming in behind it as well, is tremendously positive environment in which to tackle something that, let's face it, it isn't easy. If it was easy, we probably would have sorted it out a long time ago. There's an immense focus on care, on illness treatment, on patching people up when things have already gone awry for them. And really, this program has been a shining light, as has already been mentioned, in trying to bring a new emphasis on, let's get ahead of all of this. Let's try and enable people to be healthier, to take control of their own health, and to avoid needing interventions and coming into care with general practice or primary care settings or indeed hospitals. Because we know there's an immense demand for acute care. There's an immense demand for community care. In reality, we're trying to create the demand for well-being, because people aren't kind of coming in and saying, necessarily, or not as often, certainly, and I work as a GP, my work is with the homeless, but people aren't coming in saying, I want better well-being. They're coming in saying, I'm already ill. So naturally, there's a big focus on care and interventions. And what this program is really trying to do is to do something that in many ways our staff are too busy to do. But equally, they're too busy not to do it, because if we don't do it, we're going to be too busy for the rest of our lives. We're never going to get ahead of the game. We're never going to get ahead of the extraordinary level of demand in our health service that we simply, at the moment, are unable to meet adequately. So we're too busy in a way to do it, but we're certainly too busy not to do it. That's where making every contact counts comes in. And I was on with the Irish Association of Emergency Medicine for their annual scientific meeting, talking about well-being. And one of the things I with some temerity threw out there was this idea that the emergency department is an extraordinary, positive environment in which one could have a very big impact on people's well-being, because people, when they come into the health services, are thinking about their health. So that's a time when emergency departments could be signposting them to the many extraordinary resources that have been developed through this program. Amazing online resources, materials, campaigns, frameworks and policies, extraordinary breadth of resource that now we need to really mobilize into the system, as we are doing through things like, for example, the Healthy Communities program that's already been alluded to. Throughout my career, I've worked in Nicaragua, I've worked in Newcastle in England with community organizations, and also here in Ireland, around health inequalities and health determinants. And it's wonderful to see this body of work developing with communities that are often seen, I guess, as deprived communities, but in reality, they're the very communities that have tremendous community strengths, community spirits, and community resource that when we partner with, it's extraordinary what we can achieve. And I think we'll see, this investment in creating health communities and making the healthy choice easier strengthen throughout the coming years. Because I think sometimes, we might, in the old-fashioned way, have preached to people about, don't smoke, don't drink, don't do exercise, don't take the fizzy drink. All of these things are obviously important messages, but what we need to do, of course, is work with people to try to make those kind of healthy choices the easy choices. And the other, of course, a big area, and one that I'd be very feel very, very strongly about, is the whole area of staff health and well-being. There've been a number of people have commented on the pandemic, and when the pandemic hit, I opted in to co-lead the public health response to it. So I've been very much nose to the grindstone of that particular challenge to our society and to our health service, and it's clearly taken a toll on our society and therefore on our staff. As people have said, we have 130,000 staff, and they've experienced the pandemic as everybody else has. They've experienced the isolation, the loss, the inability to grieve, the inability to mark landmark occasions. So many losses throughout the last 2 years. It's been a very harsh time for our society and for our staff. So clever organizations, and I count the HSE amongst them, are taking staff wellbeing very, very seriously. And if they're not, they're going down a blind alley, and they really should be taking it seriously, because we need to look after our staff. If we don't look after our staff, and if we can't enable them to look after themselves, then sure as hell they can't look after the patients. So that's a massive focus, I think, from now on and previously, and I think it's one that we will continue to focus on. Equally, though, the HSE is a big player in Irish society. It's an organization, as we've said, of 130,000 staff. The interaction between the HSE and our society is greater than, I would say, I can't think of any other organization with anything like the reach in our society that the HSE has. And with that comes a great responsibility. A responsibility, I think, to show leadership in so many spaces, like looking after our staff, but also looking after our environment. The health is inextricably linked to environmental causes, and we've seen some of the references there to social determinants of health and healthy air and healthy water, drinking water, etc. So we continue to work with, for example, the EPA, and we'll be running a conference with them in the near future, where we will deepen our commitments around environmental well-being, our impact on the environment, our leadership to show that we commit to a climate change awareness program that really tackles our own use of resources in a way that is efficient, optimizing and minimizing the impact we have as a health service on the environment. So I think the HSE can continue to be a leader in this space, but we can kind of up our game. And I also see from the report, if you look at it, there's a fairly notable there's a lot of very interesting data in it. But one set of data demonstrates the difference between deprived and affluent communities in relation to harmful behaviors and the existence of long-standing illness. 33% long-standing illness in deprived areas versus 24% in affluent. More people smoke in deprived communities than in affluent communities. These are things probably we inherently know, but we have data to show it. And if you look at the lifestyle behavior risk factors at a glance as well, you can see we're starting to make some progress in some of these areas. But clearly what we need to do, for example, smoking is improving, the consumption of sugar-sweetened drinks is reducing. But clearly there are other areas that we still need to make a lot of progress on. And that means a really concerted effort of everybody working together. I think that's really been emphasized by everybody today. We need to stick together on this one. We need everybody who's on this, the 368 people I last saw who are on this webinar to kind of sign up to whatever any of us can do to promote a healthier environment around where we live, around where we work. We can start the change ourselves. And I think if everybody understands that this is one of the key challenges for the health of our nation, the key challenge, then I think that's how we'll make progress. So look at, I don't want to delay people, and I think we have a tight schedule. So suffice to say that I'm immensely proud to be in any way associated with the work that Stephanie, Helen, Sarah, and their team have been doing in the health service. I'm delighted to partner with the Department of Health with continuing my very strong relations with Colette and Martina and their colleagues and our frontline staff to really make a difference to the health and well-being of our communities and of our people coming in the coming years. And we commit today to do that and to deliver enhanced planning to build on the kind of work we've already done. So a really wonderful day today, I think, a very important day, and one which will be the springboard to further and deeper action, I think, in all of these areas. And one of the things that has been developing is the whole new kind of, if you like, academic focus on lifestyle medicine and positive psychology. The College of Surgeons have been showing a lot of leadership in this space, and they run a diploma indeed in lifestyle medicine and positive psychology. And I somewhat foolishly signed up for it a number of weeks ago. So I say foolishly, it's an excellent diploma, but my ability to deliver to it will be tested. But it's certainly something where I think we can all deepen our knowledge of the latest evidence, and it's a very deep evidence base around positive lifestyle medicine and its impact on well-being, chronic disease, etc. And Professor Kieran O'Boyle, who's our next speaker, is the founding director of the RCSI Centre for Positive Psychology and Health. He's previously led the RCSI Institute of Leadership, and I did a lot of work with Kieran in that space, because leadership would be another area of interest of my own. And he's a professor of psychology at the RCSI. He's the Vice Dean for Quality and Strategy at the RCSI Faculty of Medicine. If I give you his whole bio, I think we'd be here until about 4. He's over 70 peer-reviewed papers, 2 books, numerous book chapters, etc. I mean, a fantastic resource to have here in Ireland, and one, and his faculty is one that we will certainly be developing a very key partnership with into the future. Kieran, look forward to hearing what you have to say.
Thanks very much. Thanks very much, Phil. Let's see, can I get my slides up here? Okay, so thank you very much, and it's a real honor to be here. It's an important day, and it's a particularly important report. I'm going to try and provide a somewhat perspective from our sector, from the academic sector. And there's 4 things I want to touch on. I want to say something a little bit about health paradigms. So when we think about health, I want to just come back to this idea of the rise of non-communicable diseases, the rise of non-communicable diseases. We'll then say something about the emergence of these new specialties, lifestyle medicine and positive psychology. And then I'd like to say something about our journey as, a very large medical and health sciences university into this positive health space, and what we're learning and how our thinking is changing. our starting point.
Apologies, Professor. If you can just pop it into presenter mode, please.
Yeah, it's in presenter mode.
So you will see swap displays at the top of the screen if you just select that option, please. So just a little over to the right. There you go.
There we go. Does that do it, Helena?
That is it. Thank you so much,
Thank
Professor.
you very much. Yeah. It's always a challenge for all guys like me. So our starting point really is we keep going back to the World Health Organization definition of health, and I think that really, you know, when you unpack that, it's really surprising in some ways that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that's really crucial. It's not just physical, it's not just mental, it is also social. And just because I don't have an illness or a disease, it doesn't necessarily mean on this definition that I'm healthy. And WHO went on in 86 to say that health was seen very much as a resource. Health didn't see it as an end in itself, but it's a resource by which we achieve all kinds of other things. And I've become very interested in this notion here that a lot of what we've done in our systems in medicine, nursing, and so on, we focus on the pathogenic on the left-hand side of this diagram here. So of course we deal with patients with signs and symptoms and disability. We want to prevent premature death and so on. That's really what treatment is about. And most of us conceptualize health as not having an illness or not having a disease. But if we look to the right-hand side here, it's what Aronofsky, the medical sociologist, calls salutogenic or salutogenesis. So we talk about pathogenic, disease-producing. This is health-producing. So there's a whole other dimension to this, a whole other side to this equation, which is really about maximizing the health and the well-being and the happiness of everybody. Not just about preventing or not just about treating or curing disease. And Philip has alluded to that. So this emerging way of thinking is focusing on this much broader conceptualization of wellness. And I think that's particularly important. And we need to learn an awful lot more about the right-hand side of that equation. The second thing I want to touch on is come back to some people, a number of people have touched on it, and it is incredibly salutary when you look at the international statistics on this. As a medical school, medical university, we're based here, we're based in the Middle East, we're based in Malaysia, with a lot of work in East Africa. So we're very interested in the international dimension of this. But when we think that non-communicable diseases kill 41 million people a year, that's a huge number. And if we just take cardiovascular diseases, cancer, respiratory disease, and diabetes, accounts for 80% of all premature non-communicable diseases. In the United States, more than 80% of spending is tied to treatment conditions that are based on poor lifestyle choices. And if we take just those 5 conditions there, diabetes, cardiovascular disease, cancer, and chronic respiratory diseases, and mental health disorders, 86% of the deaths and 77% of the disease burden in the European region. So this is an enormous suffering that underpins these kinds of statistics. And as other speakers have said, the good news, of course, is that 80% of heart disease, stroke, and type 2 diabetes, and 40% of cancers, we can actually prevent through improvements in diet and lifestyle. And the evidence for that is really, really good. And I think this parallels the thinking at the moment in COP26 about the huge impact of climate change. But if we act, if we take action, it's not too late to actually achieve a significant change there. Now, as Philip says, the evidence base for the impact of behaviors and lifestyle changes is really accumulating. And that's very important because as a scientist and as a science-based organization in our CSI, we don't go beyond the science. We let the science talk. But I'm just showing you here the Lancet Global Risk Assessment. This is published every 10 years. This is the most recent one in 2018. And here they looked at 46,749 studies, controlled trials, household surveys, and so on. So this is a massive meta-analysis of huge amount of data. And what they found was the 5 leading risks in 2017, and that's the most recent data that we have for disease: high systolic blood pressure, smoking, high fasting plasma glucose, high body mass index, and short gestation at birth weight. So we know what the risks are. We know what the serious risks are. 34 million deaths and 1.21 billion disability adjusted life years attributable to these risk factors. And we also know, as Tom has said, that with socioeconomic development, we see an increase in these risk factors. So we know a lot. We know a lot about the rise of non-communicable diseases. We know what the drivers and the risks are. And we also know that behavioral change has a massive impact. And in today's excellent report, I read through it during the week, and it really is a beautifully put together report. We see the same kinds of issues rising in Ireland, that over 1 million people over 18 years of age currently have one or more chronic diseases. 49% of Irish people over 50 have one chronic disease, and 18% have more than one. 76% of our deaths are due to these diseases, and it's rising 4% per annum. So we know what the situation is. Now, the impact isn't just an impact on people, patients, their families, their loved ones. There's also a massive impact on our economy. And this is a very nice report published just last year by the McKinsey Corporation, looking at prioritizing health, a prescription for prosperity. So here they're talking about the economic value to a country or to a society for prioritizing health. Using interventions that already exist, the global disease burden could be reduced by 40% over the next 2 decades. Boy, is that something worth doing. Over 70% of the gains could be achieved from prevention, creating cleaner and safer environments, encouraging healthy behaviors, and of course, addressing the social factors that lie behind these, as well as broadening access to vaccines and preventive medicine. The additional benefit to this society is estimated, economic benefit, at $100 trillion, and an increase in GDP across the world of 0.4% faster growth per annum. So these are economists speaking. And the focus for McKinsey, the suggested focus for us, is that we make health a social and economic priority. We keep health on everybody's agenda. We transform healthcare systems, as we're seeing with Healthy Ireland and with the new initiatives from the Department of Health and the HSE. And we double down, of course, on innovation in therapeutics. So it's not one or the other, it's both and. So really, we had established recently in our CSI and university a new Center for Positive Psychology and Health. And I want to just talk about 2 of the scientific foundations for that. The first is this rapidly developing and emerging specialty of lifestyle medicine. And this is the best definition around. I think it's by Gary Egger, the Australian, one of the fathers of lifestyle medicine. Basically, lifestyle medicine is the application of environmental, behavioral, medical, and motivational principles to the management of lifestyle-related health problems in a clinical setting. And included in that, of course, are self-care and self-management. Now, you'll have all of these slides after the session, and if anybody is interested in learning more, many of you will know about lifestyle medicine, but if it's new, there's a very good literature and there's some very good places to look at. I'll say more about those in a minute. But I really love this piece from David Katz's summary back in 2013, actually, where, pulling it together, he said, the aggregation of evidence has established as a bedrock fact of modern epidemiology that tobacco, poor diet, lack of physical activity constitute the leading causes of chronic diseases. And I love this. He then talks about the salutary use of feet, fork, and fingers represents the potential to slash the risk by 80%. Feet, physical activity; fork, diet; and then fingers, smoking, substance use, alcohol. Now, even more important, or as important as that, is that the science is increasingly showing us that these kinds of interventions, diet, physical activity, tobacco avoidance, and so on, right, have epigenetic potency In other words, they have the capacity to alter gene expression. So there's some fascinating science starting to emerge now about the interactions of lifestyle behaviors and the expression of our genetic predispositions. And that is a really exciting area of research. If you're interested in finding out more about the specialty of lifestyle medicine, I'd recommend the British Society of Lifestyle Medicine, the American College of Lifestyle Medicine, and then there's a whole range of texts and good evidence-based texts from very reputable academic publishers that are now available and easy to find. So that's lifestyle medicine. Well, what's psychology got to do with it then? I'm a psychologist. Well, the first is that we're learning about very complex systemic relationships between brains, minds, and bodies. Our brains and our minds and our bodies are interconnected. We know that non-communicable diseases are growing, and if we look at the main risk factors, they are behaviors. Psychology is the science of behavior. We know mental health is emerging as a huge global issue, and we know that after the COVID pandemic, we're going to see another pandemic of mental health problems. We know that one branch of psychology, I'll talk a bit more about it in a minute, positive psychology, can improve happiness for everybody. It's not just about people with mental illness. And we know that we can scale through organizations, through the workplace, but also particularly through schools, colleges, universities, by adopting positive education approach, which combines education in knowledge and skills with the development of the person. So within psychology, there's this new emerging branch of psychology called positive psychology, which is the science, and I would really emphasize that it's the science of happiness and well-being. It's using the scientific method to explore how we can enhance the positive aspects of life. Marty Seligman and Mike Csikszentmihalyi, the fathers of positive psychology, and unfortunately Mike Csikszentmihalyi died last week, God rest him, defined positive psychology as the scientific study of optimal human functioning that aims to discover and promote the factors that allow individuals and communities to thrive. It's about thriving. And again, if I go back to the WHO and we look at their definition of well-being, they see mental health as a state of well-being, not merely the absence of depression or anxiety disorders and so on, but a state in which every individual realizes his or her own potential, can cope with the normal stresses of life, and can work productively and fruitfully and make a contribution to his or her community. So we're seeing the same kind of thinking here, that traditionally our approach in psychiatry and psychology has really been to treat mental illness, to bring people who are unwell back to a state where we're seeing the absence of mental illness. But what about this whole area up to the right again? How can we lift everybody up in terms of improving and increasing their well-being and happiness? And that's essentially where positive psychology as a scientific discipline comes in. And if you're interested in that, I would recommend the International Positive Psychology Association as a scientifically driven organization. And once again, there's a whole range of very good evidence-based texts now starting to emerge, or have been emerging for the last 10 years or so, on the science that underpins positive psychology. And some amazingly interesting research here. This is a paper just last year from the Journal of the American Medical Association, looking at the association of optimism with cardiovascular events and all-cause mortality. In other words, more optimism, fewer cardiac events, and less mortality. And the importance of that is we can teach people how to become more optimistic. Even the most pessimistic of us can learn to be more optimistic. And we've become so really interested in the mechanisms, and I don't have time to go into these, but metaflammation is a discovery from the mid-90s, which shows that in addition to the inflammatory response we get to an acute infection, there's also this underlying low-grade inflammation. You see it in adipose tissue. It's stimulated by stress, by alcohol, by smoking, and so on. and it's bad for us. It causes long-term chronic conditions. So we're starting to understand the mechanisms a bit better. Here's an amazing, interesting area, the gut-brain axis. One of the world's leading research centers in Cork with John Cryan and Ted Dinan there, showing that we have to change our paradigm for thinking about how the gut functions and how the gut and the brain function together, influence each other, and how important the gut may be in a whole range of disorders that we would never previously have considered the gut to be important in. So we're starting to understand the mechanisms and the science. Finally, then, how does an organization like ours, a huge medical university founded in 1784, how do we step into this kind of space? Well, some of the drivers for us are the United Nations, the SDGs, the Sustainable Development Goals. And Ireland, in May 2019, Ireland was the second country in the world to declare a climate and biodiversity emergency. So the SDGs are a roadmap for the world to chart its development in a sustainable way. And they're providing a universal language that's recognized around the world. We signed up to these in 2019, as have many other universities. And for us in the university sector, the SDGs are very important because the research we do addresses society's problems. We educate future generations who can shape the world. And then the impact we make on our communities at local and international level can be very profound. And I'm delighted to say that on the SDGs, on the Times Higher rankings of universities worldwide, we are joint number 2 in the world now for SDG 3, which is impact on good health and well-being. And we're really delighted about that. As Sarah says, we've set up a new Centre for Positive Psychology and Health in 2019. And the activities here are postgraduate education. We have a professional diploma in positive health running. Our first PhD starts in January. We'll be launching a master's in positive health coaching in September next year. And we'll also launch a professional doctorate in positive health and a professional diploma in coaching. And more widely then in our CSI, we've adopted a positive educational philosophy in all our faculties so that we develop clinicians, we develop nurses, physiotherapists, pharmacists with the clinical skills and knowledge and attitudes they need, but also we develop their character, their resilience, their growth mindsets. We've introduced lifestyle medicine into our undergraduate medical curriculum. We've a large public health series, My Health series, that we roll out throughout the year, and we will be founding a School of Population Health in the near future. For us in the centre, it's been fantastic to welcome people on board with the postgraduate studies, but we have been amazed at 2 initiatives. We launched in March a programme called the Science of Health and Happiness for the general public. It's 10 lectures, it's a free programme, it's online. And we expected 400 or 500 people. We currently have 32,000 people registered on that program. And a month ago, we launched a similar program for young people, which will be delivered through teachers and counselors and educators. And we have nearly 4,000 teachers and counselors registered on that. So there's a real hunger out there for valid, authoritative, scientifically based information in this area. And the final thing that I want to mention is this is an architect's impression of a building that we're planning. We've started work on it this year. It will be Project Connect. It will be on Stephen's Green beside it's part of our overall campus. And a large part of this building will be accessible to the public because we see as part of our core values, our mission will be to increase the access of the public to authoritative and reliable healthcare information and knowledge. So it's been a real honor to be here. I think this is an extremely important report. It's an important day. It is part of a movement to a different paradigm, an additional paradigm in healthcare. And I leave you with the words of the writer Marcel Proust, who said that the only real voyage of discovery consists not in seeking new landscape, but in having new eyes. I think that's what we're doing here. We're having new eyes on this chronic disease problem. Thank you very much.
Thank you very much, Professor Kieran Boyle, and how inspirational all that presentation was there for us. And I suppose there's something that word that you used there was hunger. There is such a hunger out there for the scientific and the evidence-based information, and people are really getting that interest in their own health. So this development and development of your new centre there, opened just in 2019, is huge for us here working in this field, for sometimes that we struggle in order to make people understand that this is really, really important in all of the areas that we actually cover. Congratulations and well done on the SDG 3 there. It's absolutely marvellous to know that you're actually up there in relation to at the top of them. I did the Science for Health and Happiness there during the summer, and I will say I was actually blown away by that course as well. And I won't talk anything more about any studies that I'm committed to in relation to that. So look, with this, we have now run out of time. I know we had plenty of questions coming in, but unfortunately we will not be able to hold you on any longer. That wouldn't be fair to you, as we committed to finish at 3:30. So with this, I will draw our webinar to a close. And in that, I want to thank everybody that helped and worked with me in making this webinar possible. To our speakers that came here today, a big thank you to all of you. And along this journey, in that 5 years and working on this, the journey of Healthy Ireland, and looking forward to the future in there, I want to thank my line manager there, the interim manager for Health and Wellbeing, Helen Deely, always supportive along the line they're into it. And of course, to you, all my colleagues on my own team there, the National Policy Priority Programme leads and the wider team across there, that we all work so cohesively across them there. And I just cannot close here without actually saying a very special call out to my own very dedicated Health and Wellbeing Healthy Ireland team in the HSE, to Yvonne Gilson and Deirdre Rooney and to Fiona Donovan. You know how much I appreciate you, and you know the great work that you do in order to keep me on track. I thank again IMS, our technical partners, especially there Helena, for keeping us online on track and digging us out when we do actually get those challenging times. So with that, I am going to say to you, Slán Slán, go nari an bóthar live, agus go raibh míle maith agaibh.